To share with us the net takeaways to address COVID challenges, would like to give the floor once again to Mr. Dale Weeks.
Okay, well, good afternoon, I guess, to most of you here. What we're going to talk about now is two things: the net takeaways from our COVID challenges, and then we will have a hackathon challenge to engage our participants and our delegates and audience in helping us out with some solutions for the healthcare field. But a net takeaway, I think we've got several items that I concluded and took notes on from our panel discussion and everyone else. I think the first thing is each of us involved in our own countries, whether it be those of us that are on the panel or in our own countries where we sit as far as participants, to try and come up with one local thing that we can do to expand the involvement in best practice sharing at the local level. And then we will collect those together and see what we've got in terms of a broader global message. That's the first thing. Secondly is to work on building a social media impact. Use some of the existing platforms for social media to get our message out, and whether we do that via perhaps a video, something where we could create buzz, as it's called, or create a virus that goes out there that says performance excellence. It's out there, we are here, and we seek to have an impact on the world. So we'll look at social media, we'll look at doing things globally, and then also one thing that I'm going to look toward in focusing back on our recommendations is try and find one global organization that is not involved in performance excellence. So each of us can get outside of our local national community in terms of, as I call it, those that are not in the choir, that are not singing with us from the same hymn book, if I can use that analogy, and find one major organization that has potentially global impact that we can have some influence on, and getting them on the performance excellence train, so to speak, over the next year or two. So whether that means looking at the one presentation organization we had today, which was from Social Progress Imperative or the Social Progress Index, talking about outcomes, or we could identify, in this case with COVID, with the World Health Organization or the Gates Foundation. The Gates Foundation is extensively involved, and I have taken some effort over the last month to try and initiate some contact with these organizations and build maybe one major partnership over the next few years into these organizations to get excellence into them on a broader basis. So that's what I would conclude as some of our best practices to take forward out of our panel discussion. And now I'm looking at on the screen, if everyone can see it, the attendees, and we've done a poll. First recommendation, to build a global excellence. Quite an extensive 76% of our people saying we should look toward building a sustainability institute in collaboration with these organizations. Now we're up to 80, 81, 82, 83%. So it looks like that's a major thing to focus on. And then the second, do you support the idea that performance excellence leaders should be more united in creating a global? Here we've got 100%. Wow. 100% greater collaboration. Now what that means is what we've talked about on the panel. We find those few areas where we can collaborate. It's not easy to do. We've each got our own individual organization or country perspectives. But if we can find a way to be more united in creating a global coalition. And so I would ask everyone that is here today on this session, panel member or participant, to communicate with us, whether it's individually, those of us on the panel, or with me or others involved with the PSG or the Global Benchmarking Network of areas where we can become more united, and what you are willing to do. Because what I'm looking to put together in the next several months is, I've called it a global COVID-19 collaborative coalition, a coalition of the willing, the coalition of those that have the commitment and the political will to move this performance excellence forward. I think we owe it to, and what drives my engagement is here of just continuing to look at and hear. And if you have people in your family, 250,000 people have died from COVID. I think we owe it to ourselves and to our relatives, our friends, our families, whether they be here in your own individual community or across the globe, to respond and owe the legacy of these people that have died from COVID, to say, let's not have that happen again. That's what benchmarking is all about. If you may have heard in the history arena, if you don't know about the past, you're bound to repeat it. So I'm trying to use benchmarking to say, gee, we've got COVID-19. What happens when COVID-20 shows up? COVID-21, COVID-25. Have we learned our performance excellence message to take that forward? So this has been very helpful. We've got the votes on this, and we'll go forward from that. So I think that's very encouraging poll from our participating members. We're now going to move on to the hackathon part of this, which is, we've got a question where we want participation from our audience. And it gets to the issue of healthcare. We've had quite a few presentations over the last several hours on healthcare. We had one from Teresa on Medical City. So we're looking for how we rebuild trust. Under COVID, some of the breakdowns that's occurred is we're now waiting. I can use the example here in the United States. We're waiting for the vaccine. But we have developed over the last year or more, especially under COVID, of an anti-vaccine kind of community. Why should I trust the healthcare community to do the right thing? Or if you're asked to have a test, how should I do that? If I break down in normal annual physicals. So our question to our audience today is, what newer, innovative, or unknown disruptive healthcare practice ideas do you have that would further rebuild or strengthen trust in our healthcare system? If you're not asked to have a test for COVID, or fortunately many of us hopefully will not be affected by COVID, but how would you adapt disruptive innovative ideas? What kind of ideas do we have that would strengthen or rebuild trust in the delivery of healthcare? Whether it be telemedicine, for example. We've said a lot about online. What ideas do you have in terms of delivering disruptive ideas for the healthcare, so you can get the same degree of trust that you would have many years ago? Some of us can speak to proper bedside manner. If your personal physician came to your home and delivered, same kind of trust there in a digital environment, or where you had to go to a clinic, or wherever you have to go or would go. What ideas do you have to rebuild the trust in the delivery of healthcare services? So we'll open it up for submission of ideas. And I would also ask, perhaps Teresa from Medical City would have some additional comments to make regarding this hackathon challenge. So what we're trying to do with a hackathon, if you haven't worked with hackathons before, they're known in the computer industry, where they spend maybe a day or two or three trying to address a real critical challenge. And so we're looking at getting ideas, and then there will be award over the next few weeks of the most promising ideas regarding building and strengthening trust in our global healthcare community. So we'd like your input on that question.
Much, Mr. Weeks. Now, to further expound on the World Hackathon Challenge competition, we'd like to call on the Vice President of Business Intelligence, Innovation, and Benchmarking of the Philippine Society for Quality. Please welcome back Ms. Teresa Bagaman.
Hello, everyone. Hello, Dale. Again, Dale, before we start, I again want to express our appreciation to you and Don and GBN to acknowledge you as the moving spirits from US and Canada who help us make this first World Innovation and Benchmarking Summit possible. We are now in this interesting segment where we will challenge our audience to share their disruptive innovation idea. Our objective is to be able to crowdsource from all over the world and discover disruptive innovation ideas. As you can see in this slide, this is our Hackaton Challenge question. How might we? The format is like a design thinking study. How might we adopt disruptive innovation ideas that would strengthen or rebuild trust in the delivery of our healthcare system? Dale, we will be giving everyone, the audience now, we will be giving them a chance to participate and give their answers. We will be giving them 5 minutes to think about their answers. And for this session, the first 3 answers will be given special prizes. Friends, please submit your answers to Slido, again, using code 45616. You have 5 minutes to quickly write all your answers. And we're excited to find out what these innovative solutions would be. Time starts now. Friends, welcome back. So, where are all those answers? It looks like we got some very disruptive innovation ideas. Are you all excited to find out what they are? So, let me read some of them. So, from Dr. Roland Remini from the Medical City. So, his idea is to offer vaccination pubs where people can grab a pint and a shot, not of alcohol, but of the vaccine. So we make the process a social activity, why not? And offer vaccination movie screenings where people can get vaccinated at the mall and then have a seat at the first screening of James Bond movie 2 weeks later. Wow, that's a great idea. We want to do that. Let's see. Now the second one is, she or he didn't state her name, but this is, she's suggesting a most innovating solution in healthcare for underprivileged ones. So we still need to find out what the specific idea is. So we'll get back to you. Oh, my friend Dale. So Dale, are you there? So I will read your innovative idea. So it's to return to personal physician healthcare visits to our home, not in a hospital or clinic. So I remember when I was 10 years old, that's how we got cured. The doctor goes to our houses and then have these physicians take exceptional patient service training as part of their medical school training. Very good, Dale. Now we have from Marjun. We want, her idea is to study medicinal plants available around to treat ailments. Okay, and we also have from Felma Tria to develop an application that tracks rapid testing, swab test results, showing the movement of individuals for easier contact tracing, and an application that tracks safety protocols per province so that we may be guided on what to prepare if we decide to travel by land. Great! Now we have another idea. Looks like you're all brimming with innovative ideas. So this one is an approach to shift the mindset in medical care from overemphasis on late-stage cures to health wellness and prevention of health illnesses through education. That's correct. So, for now, these are the ideas that we got, but no worries. This is just the beginning of our collaboration for you to send us all of these disruptive innovation ideas. You have this segment, by the way, is in partnership with the Medical City's Center for Innovation and Lifelong Learning. And you have until December 3 to share your disruptive innovation ideas and to send them to TMC's Center for Innovation and Lifelong Learning. So this is our email address. Do you have your pen? So it's TMC, T for Tango, and then you have MC, and then underscore CILL at themedicalcity.com. So we'll just repeat that. So we have TMC underscore CILL at themedicalcity.com. Did you get that? So for those who submitted their answers, we will be giving you special prizes. For those who were not able to put their names, just put your names and how can we reach you so that we can send our special prize to you. Those who will be really giving us truly disruptive innovation ideas, we have bigger prizes for you. We have our 4 criteria. In general, we'll follow the design thinking criteria. Okay, do you have your pens? I will be giving you 4 questions. So when you think of your disruptive innovation idea, think of these 4 questions. 1, is it human-centered? Which means your point of view is always the customers. Second, is it technically feasible? Which means it is something that it will really work. And then third, is it viable? which means we don't have to spend billions of dollars in order to make it work. And of course, the fourth is it new or transformative? Maybe at least it's not yet working in the Philippines. Is that fair enough? So let me repeat the 4 questions. Number 1, is it human-centered? Number 2, is it technically feasible? Number 3, is it viable? And number 4, is it new or transformative within the Philippines? So, are you excited? We are really excited to receive all those disruptive innovation ideas. And we hope if we continue to crowdsource these ideas and collaborate with each other, we will continue to be able to improve our healthcare system so that we can definitely rebuild the trust in this system. Thank you very much, Sudale. Thank you for joining me here. And let's get back to our next speaker.
Thank you very much, Ms. Teresa, for sharing those questions and those innovative, disruptive solutions. Keep them coming.